Once again, a warm welcome to everyone and thank you for joining today's at the Alliance Conference, and welcome for joining this What Matters to You session. The agenda today, and my colleague will put in the chat today's agenda. We'll be having a conversation about what matters to you. We'll be launching a short film, and then we'll be having a conversation with some of our colleagues who participated in the film. We also have BSL and electronic note takers, so thank you to Mark Cross, Stephen Patterson, Andrea McMenemy, and Paula Maguire. So my name's Tommy Whitelaw. I'm the National Lead for Caring at the Health and Social Care Alliance Scotland, and I'm joined today with my co-chair, Irene Oldfather, the Director at the Health and Social Care Alliance. So welcome to the What Matters to You session. The What Matters to You approach of person-centred care and listening has been at the heart of the Alliance Carer Voices project since 2016. We have gathered 30,000 What Matters to You pledges and launched trees and What Matters to You boards across the country. Although every day should involve taking time to ask people what and who really matters to them. I'm joined by colleagues across health and social care and colleagues who are participated in our short film, and we'll get to know each of the panelists as we go along. Just to reiterate, in the chat function you'll see at the bottom of the screen, that's for comments and posting. We'll be posting relevant links into the chat. The Q&A is for questions to be put to the speakers. So if you have any questions from anything that we're chatting about today, just pop them into the Q&A session, and we'll have a conversation. As well, we've all been, as personally, me and my colleagues here at the Alliance, we've been working from home for the last year. So we thought we'd ask some of our colleagues across the Alliance what matters to them. And they've kindly put little boards together. And just before we start the session, we'd like to share with you some of the things that matter to our Alliance colleagues. We might come back to that. We'll come back to that at another point. That's okay. So once again, thank you for joining us today. So let's start the conversation. Can I introduce you firstly to Sean Mayer? Sean is the Strategic Advisor for Person-Centred Care within the Scottish Government and the Principal Educator at NHS Education for Scotland. He's also the Chair of the What Matters to You Scotland Steering Group. Sean, welcome today and thank you for joining us.
Tom, it's a pleasure. Lovely to be here and to be part of something that's so special and important, and looking forward to the conversation this morning.
And I have to make an admission, I've finished a lot of Sean's work to share at my talks. He says I've lovingly lifted it. I said I've finished it, but he says I've lovingly lifted it. So thank you for allowing me to share a lot of your work at session. Sean, today is What Matters to You Day. Can you give us a wee bit of a background on the day, on the movement, and the importance of what matters to you?
So it's interesting because my background is a nurse. I worked as a nurse for more than 20 years, and I still am a nurse, but I don't work clinically anymore. And throughout that period of time, it always felt like there was a bit of a battle at times to be able to do what you felt was the really important things, to do the things that really mattered. And I was always puzzled as to why that was really. And along with Jennifer, who's on the call, Jennifer Rogers is on the call with us as well, we had a fantastic opportunity to take a pause in our clinical careers and to learn about how to improve complex systems. And as part of that process, and I think it was a similar experience for Jennifer, she'll talk for herself, but as part of that pause, it was like, oh my goodness, what it is here is what we're missing is this opportunity to connect with people and to really listen and understand what matters to them. Now, we didn't frame it like that. We didn't call it what matters to me or what matters to you at that time. We kind of just had that moment of recognition. But also as part of that process, we were kind of connected to this worldwide group of people who were trying to improve healthcare systems. And in our context in Scotland, not only the healthcare system, but the social care system, the education system, all of our public sector. And we met a very inspirational lady called Maureen Bisignano, who some of you will know, and some of you will have seen her Joan Whitelaw lecture, which took place yesterday. I'm looking forward to catching up with that and having a look. And we went to a healthcare improvement conference where she spoke to us about a paper she'd read by a lady called Susan Edgeman Levitan and a man called Michael Barry. And they were talking about healthcare settings and the challenge of reaching genuine shared decisions with people who we were sort of caring for and providing support for, and who were getting treatment in the healthcare system. And they said, what this boils down to is the need to shift the focus from what matters or what's the matter with you to what matters to you, to get into what it is that, to speak to the whole person, if you like, not to focus in on just a disease and trying to fix a disease, and to focus on the strengths that individual had and the resilience, and then think about how in partnership together you could work with them and help them. So this phrase, what matters to you, came from that. Maureen challenged us all to go away and to have a conversation about what really matters. And Jen was in the audience that day. I was in the audience. A number of other people from around the world were in that audience. And we went back to our day-to-day work and started trying to do this. And then a friend of ours in Norway, Anders, came up with the idea of having a day every year where we remind ourselves of the importance of this. We celebrate what we've been doing, and maybe we reset and refocus on the new challenges that lie ahead. And that was in 2014, and he invited his friends in Scotland to join him. And the invitation went out then from us to all of our friends around the world, and we now have, I think it's more than 50 countries participating, and many thousands of healthcare, social care, teachers in primary schools, housing associations, all manner of different areas of public service, focusing on this question, what matters to you? Now, there's still a lot to do, even though we've hit 50 countries, if you like. It's wide and thin, I would say, at the minute, and we want to go much deeper. But that's kind of where it came from. And I guess if I had to sum it all up, what this is about putting the listening back in a very intentional and deliberate way, and remembering that we're not necessarily here to fix everyone. I think that's kind of how a lot of healthcare professionals in particular have been trained. It's my job to sort of share my expansive knowledge with you and to fix you. And actually, in our complex world and in people's complex lives, that's not how it works. Actually, what we need to do is we need to listen, and we need to get alongside people. And remember that even sometimes, there isn't anything that we can do, but by listening and being with someone and beside someone, that in itself is incredibly helpful and can be incredibly powerful. So I guess that's kind of where it all came from, and that's maybe part of why we're here today, and part of the reason why your film, Tommy, and the great work that you've been doing is continuing.
There's lots happening today on social media, lots of conversations on social media today with the hashtag WMTY 21. And also people can get involved through the What Matters to You website as well, Sean. There's lots of resources and case studies on the website.
Yeah, we'll stick a link to the website in the chat, www.whatmatterstoyou.scot, and through that you can link to there's a What Matters to You, a WMTY.world website as well, which is the global community and of people who are sort of and it's not, there's no sort of official paid positions or anything like that. This is people who are kind of doing this almost as a hobby, and I think that's part of the sort of enjoyment and pleasure of being involved in this work. The people who are there really want to be there and really want to make a difference. So yeah, so have a look at the website. There's some free resources there. There's some stories. There's connection across the globe with people from Australia, New Zealand on the furthest side of the planet, right through China. No, actually, I don't think we have got China. Actually, we've got India, Malaysia, people, even Afghanistan, into the Middle East, Israel, Saudi Arabia, the UAE, right through Europe and across the other side of the Atlantic to the United States and Canada and South America. Brazil especially is a hotbed of what matters to you. Very passionate, the Brazilians. So yeah, we have lots of fun interacting with them. So yeah, there's lots there to get into and to learn about.
Oh, thank you, Sean. Thank you for giving us a wee bit of background on today on What Matters to You Day. And We will come back to you later on in the panel conversation. I'd like to introduce now Jen Rogers. Jen is the Deputy Nurse Director for Corporate and Community Services at the NHS Greater Glasgow and Clyde, and was formerly the Chief Nursing at the Glasgow Children's Hospital. And she won't mind me mentioning she was the Scottish Nurse of the Year in 2013 and Scottish Women of the Year as well. So welcome, Jen. Thank you. Welcome to today's panel session.
Thanks, Tommy, and thanks for having me. And good morning, everyone, and happy What Matters to You Day 2021. Delighted to be here. You asked me to reflect on how what matters to me sort of actually works, what we've actually done. And Sean's helpfully talked a wee bit about the background, and I was lucky enough to be at that conference in Paris and was a senior charge nurse at the time and thought, stop the bus. This is something that we can just do. It doesn't cost anything. I can just do this in my ward in Paisley, Paris to Paisley. And there I came up with the idea of a tool, making a tool out of the What Matters to You conversation. And that was simply a poster where children, it was a children's ward, where children could draw pictures of what matters to them or write little lists of what matters to them and put that either above their bed or on their door. They could use glitter, feathers. And what happened with that was interesting because people thought they knew what mattered to children. They thought they'll say this or they'll say that. And they said different things from what people expected. And it just consolidated something that I think I'd thought for a long time, was that we make assumptions about what's important to people and what matters to people. We do it in our lives and we do it in our work. And what we believe matters to patients, stroke residents, stroke families, there's a disconnect between that and what actually matters to those people and individual people. So that was me. I've been on a crusade, if you like, for a decade on how to listen to what matters and ask what matters to people in all sorts of settings. So it started in paediatrics with the tool, spread to the big children's hospital in Glasgow, then to children's units right across Scotland, then to older people. So there was a gap in the middle. We were doing children's, asking them what mattered, and older people, because there's a sort of, people think there's a similarity, maybe there is, between those two groups, but from there it developed to everyone in the middle. And I'll be honest and say that is still a work in progress. So some areas do that very well, have it in their system where they'll ask what matters and have meaningful what matters conversations. And we've lots of areas now have whiteboards where it'll say what matters. And some staff are fantastic with families and patients at filling those in. And some we're still on a learning journey. It's a long game because it's a massive cultural, I think, shift in the way that healthcare is. So we're moving from a model that was probably quite hierarchical, and the doctor says, so we will do, to a very collaborative, integrated approach where we don't make assumptions, but we work together on the best way forward and the best care planning for individuals that's right for them. So that's kind of how it's been working in hospitals and in acute care. And this year, now I'm in a different job as well, where we're doing celebrating the day and kind of promoting the way of thinking within lots of different environments, including care homes and prisons, and all sorts of different community and acute environments across NHS Greater Glasgow and Clyde. I think what I've found from working for 10 years and asking people what matters is the little things are the big things. Little things that might seem little are really important to people. And it's often so easy and to just have those conversations and be able to do something that makes something a little bit better in that experience for that family or that person. As Sean says, sometimes listening is the intervention, but often you can just make a wee change to the care planning that seems small but has a huge impact. And I could sit for hours and tell 100 stories of huge impacts from asking such a little question.
I'm kind of with you on that. You wrote on a napkin one day, ask what matters, listen to what matters, do what matters. And for me, there's something incredibly, we won't always be able to do everything that's asked of us. And sometimes that puts people off asking the question. But for me, there's something incredibly beautiful about feeling listened to in my own experience, in my own struggles. That moment, for me, that's one of the important parts of what matters to you, is creating that space to really listen. And from someone who struggled to be listened to when caring for my mum, those moments when your heart, you really feel listened to inside, they're really, really important. There's such a gift, the listening part of it.
Absolutely, absolutely. So it's so important. There's been a kind of, people are rushing, aren't they? They're always busy, and it's on to the next thing, and maybe a wee bit task focused sometimes. So what we're trying to do in this movement is integrate this into the culture, where listening and asking and having a connection that's more meaningful with people. I mean, I really believe, how can we look after or work with people for the best outcome if we don't even begin to know what matters to them or understand them a little bit?
Well, thank you for that, Jenny. We will come back to yourself and Sean and others at the end for a panel conversation.
Thanks,
Thank you. So on listening and conversations, I'd like to introduce our next guest, Parveen Khan, who's is the Race Equality Mainstreaming Officer at the Council for Ethnic Minority Voluntary Organisations Scotland, and also part of the What Matters to You steering group. So Parveen, can I ask you, can you chat to us about the diversity of asking what matters to you, the representation, and some of the barriers to the conversations?
Thanks, Tommy. Yes, I'd love to. It's lovely to be here, and it's really nice to be part of What Matters to You today. Yeah, I think I wanted to sort of not reiterate what Jennifer and Sean were saying, but actually add to it and say that absolutely one of the main things that comes out of What Matters to You is the active listening, and the fact that we're not all very good at it. Active listening. Jennifer's already said, we're very it's very busy, and sometimes you listen but you only listen with half an ear, and I think that's one of the things that I've been a community worker for a long time, a community development worker, and the work that I do really requires active listening. So what I've found throughout my work is that in order to become really inclusive in an organisation, you have to engage your people or your audience or your service users. And in order to do that, you have to start with understanding the culture, actually getting on board with saying, well, if we get better at listening, we can change the way we communicate. One thing COVID and the pandemic and last year we've noticed is that we might be actively listening and really engaging when we're on webinars and in Zoom meetings and things, but it's very tiring to do that. It really does take a lot out of you because you're concentrating, you're really actively listening. And that's the thing that we need to get better at doing when we're face to face with people. We have to make time to listen, because if we don't take the time and make the effort, people know that they're not really being listened to, and that adds to their disengagement and the lack of regard for people who are trying to support them, to help them. So my tips, if you'd like, to be an inclusive organisation would be to listen like a lawyer, because good listening requires ongoing practice and development, and lawyers are really, really good at that. They pick up on things. I've noticed with myself as well that when we're wearing masks, it's sometimes difficult to really actively listen to or understand what people are saying, because one part of the communication is missing. And that, for me, I must really rely on almost lip reading, if you like, or listening into people. But the emotions or your expressions, all that helps as well. So again, I'm really saying we really need to actively listen. So again, so a lot of us do the kind of Euro Millions and have lottery tickets and that. But if we even use that as an example and say that we're actually looking at our lottery ticket to see if we're in the running for the millions, and say we've got 4 numbers that have come up, what are we doing? We're actively listening to see what other numbers are going to come up and whether or not we're in a chance to win these millions. And if we listen closely enough, we hear and we grasp true meaning. So if we do that in conversations with individuals, if we're doing that to find out, to get clues, to actually understand what is really going on, people feel valued, they feel understood, and they feel that their opinion counts. And that becomes a communication becomes 2 ways, without any conflict or misunderstanding. So yeah, I think certainly to be an inclusive organisation, we need to think of going over and above, just being not tokenistic, but often saying, well, we've talked to people or we've consulted with people, but really engagement, that's a process. It's longer term and it's far more sustainable, but it helps us to be more inclusive. It means that we can go beyond our sort of well-written values, or we can beyond the ideology of being an inclusive culture, because sometimes what we do on an everyday, some of the behaviours every day actually are quite contradictory to that. So it means we can move beyond that. But I think what I'd really like to emphasise is that true dialogue, yes, of course, discussion, any discussions that we have that are aimed at harnessing lived experience. So when we talk about patient care, we talk about patient experience, we talk about lived experiences, that gives us a mutual insight and common purpose in a trusted environment without judgment. And I'd like to share again another example of that. My youngest daughter's boyfriend, he's actually, he's got a voice box, and he was quite nervous about meeting me for the first time. And I think that was maybe because he's quite young and he's had experiences, maybe not so good, positive experiences, but of people fixating themselves on this voice box, but also not quite understanding what he's trying to say, how he's trying to communicate. And being quite young, that his confidence was quite knocked. And what was really, and I was determined that I wasn't going to do that. And I was going to really get to know this young man, because I was really proud of my daughter as well, that she could see beyond the voice box and fall in love with this young man for who he is. And I think that's so important. And I wanted to share that, because when we met for dinner, we met in a public place, even though he's quite nervous about public places for all the obvious reasons. But we met in a small restaurant in Edinburgh that only has like 4 tables. So it wasn't too daunting for him. And as I said, in order to connect with this young man, it was really looking at his face and looking into his eyes and really connecting with him, rather than, even though I found it difficult to understand what he was saying, but he kept having to press this box in his throat in order to speak. And it was a lovely experience, and just speaking to him and things. But I think what we often make assumptions, and Jennifer mentioned this as well, is that we often make assumptions that we always need to fill gaps and fill silences, that we actually, in order to, that sometimes we need to solve other people's problems and things, but it's just enough to be able to just listen and actively listen. And I really can't stress that enough. It really makes people feel valued, and it makes people engage better, and they feel that, I'm not being judged for what I'm saying or how I'm saying it or how I'm coming across. And that's really important. So I think, if anything, I'd like to say as well that a little bit of that really requires courage as well. If we're having these conversations, what matters to you, and we're having them in a kind of courageous way, it really means that we must be doing something right. Because courageous conversations will inspire perspectives to be shared and voiced and heard. And that's what accepting diversity and embracing inclusion is all about. So the inclusion, true inclusion, is a collective effort, and that concerns, benefits, and involves everyone. And when it's done well, there are lots of benefits to that. So if there's one takeaway from today that I'd like everyone to be able to do, so takeaway is, and even by listening to me, is to make time to learn to how to actively listen and actively engage. So I think that's certainly what I would be advocating for today.
Well, thank you so much. There's so much to take away there, Parveen. And as if you know me well, I love a wee love story in the middle of anything we're speaking about. So thank you for the love story.
No
and
problem.
actually, I completely agree with you. It's about confidence, isn't it? Sometimes our words and actions affect the confidence. So let's be confidence makers today, and never ever be confidence breakers, because when your confidence is broken, it's quite hard to recover from. It's also Carers Week today, and and you also mentioned a lawyer as well. Be like a lawyer. I might leave a lawyer before I introduce my boss, Irene Oldfather, here, if I've done the first part of this session correctly. So just before I introduce Irene, as it's Carer Week, some colleagues who are going to participate in today are unable to make it today because of their caring role. And I think we have to, it helps us understand a little bit. Some colleagues who participated in the film and wanted to be part today have been in touch that due to caring responsibilities, they're unable to attend today. So we're sending our thoughts and our thanks to them for everything that we do. So that's my part of the session over, I'm glad to say, and hopefully I won't need a lawyer. But I'm going to introduce you to my boss. I'm going to introduce you to my boss, Irene Oldfather, and my friend more than my boss, who's Director of Strategy Engagement at the Health and Social Care Alliance. And Irene's going to help launch our film and have a conversation with some of our colleagues who participated in the film, and then open up to a whole panel session. Thank you, Irene.
Thanks so much, Tommy. Good morning, colleagues, and thank you, Tommy, for inviting me to join the session today. It's a privilege to be here in What Matters to You Day, and actually I've spent some What Matters to You days in other places, speaking to colleagues about what matters to you, often in Brussels. So it's a bit of a change to be here in Scotland, but it's great to be able to connect virtually with colleagues, and I really enjoyed hearing the interventions from Sean, Jennifer, and actually that some of the great and amazing tips there that Parveen gave us. So thank you for that. And as Tommy mentioned, this is Carers Week, and of course our conference is entitled this week, Equally Valued, Equally Connected. And we thought, in looking ahead to today, that combining what matters to you with thinking about our carers was an appropriate thing for us as an organisation and as carer voices to do. So I'm really delighted to be able to launch this short film that we made with carers. And I do feel, I believe, there can't be a more appropriate group to take the time to ask, what is it that matters to you and what's important to you than carers? So I've got a great pleasure and thanks to everyone involved in this, in launching our film, which I'm hoping Jennifer's now going to play for us. Hi, I'm Irene Oldfather. I'm Director of Strategic Partnerships and Engagement at the Health and Social Care Alliance Scotland. I work there with Scotland's advocate on what matters to you, Tommy Whitelaw, and we work to make sure that carers across Scotland have a strong voice. So for us, it's about moving the conversations and the dialogue from what's the matter with you, a deficit-based approach, to what matters to you, an asset-based approach, where we hear, listen and act upon what carers tell us. So for this short film, we asked some of our Conversation Cafe carers what matters to them, and here's what they said.
The things that matter to me are that mum's basic human rights are met, and that I'm seen as an equal partner in care, and that communication is a two-way thing.
What helps you if you're maybe going to the doctor or the dentist together or the optician? What's important to you when you're seeing these people, Ian? That they listen to you?
Yes.
That they listen to you, yeah. So for me, I, as a family member, I think just having that recognition that you are a carer and you're there to support a loved one and are able to kind of advocate on their behalf if and when needed.
The opportunity to take respite is incredibly important, and it's something that I'm still learning. I'm still learning to balance it. I'm still learning to feel okay with taking it. I used to feel that I had to justify it all the time why I'm a full-time carer for my child.
I use music as some people say, like an escapism, relaxation, just to evoke different memories. So to be able to still pursue that as a hobby, for me, is very important as a carer, because it allows you to have a life out with caring and keep your identity.
Most of the professional doctors, nurses, everything, if I ask them to explain, they will. They will take the time, and that's invaluable.
Communication is so vitally important, but I would say on the other hand, it's the inclusive communication that makes life for deafblind people so important. I think sensory impairment awareness training is so vitally important. It should be mandatory.
Carers have got rights as well. They should be getting a support package if required without having to ask for it.
The little things that are important, it's not rocket science.
So having heard these experiences, it's a powerful reminder to us that always beginning with this focus on the things that really matter and understanding those things is the cornerstone of high quality compassionate care, and also the power of listening. Listening is in itself a powerful intervention. And the other message that I take away is that people rarely exist in splendid isolation, that they are often part of a complex web of sometimes beautiful, sometimes challenging relationships. And this is especially the case for carers and those that they love and they support. And we should do everything we can to support and strengthen those relationships and to sustain them. So always start with a focus on what really matters, and always remember to take notice of who matters too.
At Carer Voices, we acknowledge and encourage the value of listening and the 5 must-do with me steps. What matters to you and who matters to you? What kind of information do you need? Nothing about me without me. Creating service flexibility. Keeping these 5 must-dos at the heart of our thinking, conversations and listening, we create more meaningful relationships in environments where care is being provided, and more flexible services in our communities for each unique individual and family. So let's take the time to ask what really matters. Let's create the space and time to really listen to what matters. And once we have asked and once we have listened, we create more opportunities to do. So please get involved. Join us at Carer Voices at the Health and Social Care Alliance Scotland, and let's take the time to ask and to really listen to what matters to you.
Well, I think that came across as quite a powerful film, and it's really great to hear people themselves talk about what is important to them. And I heard communication, I heard things about being valued as equal partners, and I heard things about a little bit of time for myself. And I'm delighted that we're able to be joined this morning by two participants, Jim Guyan and John Whitfield. Jim joins us regularly in our conversation cafe from Shetland, and usually has these amazing backgrounds that make us all very envious and wish we were up in Shetland, often of interesting birds, and I have to get him to describe them. But it's great to have you with us today, Jim. And Jim's a carer, a kinship carer, and he's also the carers representative for Shetland IJB, and he works within and supports the Shetland Strategic Planning Group and the Carer Strategy Group. So, Jim, you're a busy man, and I'm very delighted that you're able to join us today and you're able to participate in our film. And we've also got John Whitfield. John's a training officer and participation officer at Deafblind Scotland, where I know he's passionate, and he ensures that we all understand that importance around communication for people with sensory impairment. And Jim, thanks so much for joining us today. And as Tommy mentioned, there were one or two others that couldn't be with us today, and we understand that because that is just the nature of caring. But I'm glad that John and Jim could join us. And I guess we asked you just to do a very short clip for that film because we wanted to get quite a few different perspectives in, but there's an opportunity maybe to tell us a little bit more. And having been in politics before, you were always taught never ask a question you don't know the answer to. So I'm about to make a fatal mistake because I don't know the answer to this question. But I wondered if each of you, how did you come across what matters to you? I'd be interested to know that. And do you feel, from your experiences around making the film, is it important? Does it feel real, and does it feel important to you? Jim, do you want to comment first?
Thanks, Irene. I got involved, as you say, it's through the cafe, right? I joined the Alliance to try and get more information in respect to support for carers and how the way forward. Right? In my role as a carers rep on the Integrated Joint Board, trying to steer people in the right direction. And people to sort of respect carers more. I think we're a forgotten army, sitting in the background. We just look after our loved ones, and we're forgotten about in some respects. And I feel that there's an awful lot of work needing to be done for carers. Unfortunately, we have this situation whereby I would say that 80% of carers do not regard themselves as carers. That's the main problem. Right? And a lot of these people are sitting there and they're caring for their loved ones, and with no support at all, where the system is there to provide support, right? But there's not, how could I say, not enough publication about this, and bringing it to the forefront and letting people know that there's people there to help them. Right? And that's part of my life, is trying to develop this and ensure that people in Shetland, if they're a carer, and require help, that it's there.
So, could you just imagine, Jim, if in your connections with and contacts with and daily interactions with health and social care professionals, can you just imagine the difference it would make if, instead of, starting the conversation with you by saying, hello, what's wrong, or what's the matter with you, if they actually said, good morning, Jim, tell me a little bit about you and what's important to you. It seems to me that would make a huge difference.
I think, living in Shetland is a different experience from living on the mainland. Right? You know, I came up here originally in '94. I had 24 years in the army where you just did what you were told. Nobody listened to you, right? You know, and then I came here to work. And, you know, I think we've been a group of islands with just 23,000 people. I mean, I live on an island with 500 people. And, you know, this listening thing, people do listen to you here, I think, more than what they do on mainland Scotland. You know, because our doctors are not so hard pressed, our health practitioners are not so, you know, hard pressed as what they are on the mainland in some respects. But I think it's good, like Sean was saying, it could still go a little bit further. Right? You know, people know what's wrong with them if they go and see a doctor. Right? You know, if you're a carer and you have to go to social services, you know what you need. Right? And this idea of, you know, prejudging people, as I say, you know, the idea of going to the doctor and he's got your prescription ready for you when you go in, type thing. You know, that I could remember these days. You know, I'm old enough to remember them. Right? And I must admit, it's great now that doctors don't do that. They tend to sit there and listen to you. You know your body. I'm here to help you. Right? It's the same with social services staff. Right? You know, if you're required to go to social services for support, you know, they should be sitting there and listening, as you say, listen to your story. Find out what you can do, what you can't do, and then start working out a program of assistance for you. Right? You know, don't go into somebody's house and sort of say, oh, fine, oh yeah, we'll give you a couple of hours of help a day. Right? That's maybe not what that person wants. Some people don't want that. You know, they want something else in their life, whether it be respite care. Right? Some carers would be perfectly happy with just having respite. You know, and they're happy in their little world. But, you know, this idea of having time off, time to be able to go shopping, this type of thing. Right? You know, as I say, not all support has to have a financial implication to councils or a great financial implication to them. Right? It could be minimal support, but that's enough to keep that person happy, healthy, right? And keep the carers out of hospital. Because this is what happens. You burn it and you end up being ill yourself.
So is that being valued and connected, which is the theme of our conference today, is really important, Jim. And, you know, I heard you talking there about the quiet voices of carers, and I have to say, when I was in Parliament, I often felt that, quite rightly, lots of groups lobbied us, but the carers were at home looking after people, and sometimes it felt like the people we most needed to hear from were not able to come. So I understand your points there about the quiet voices, and that's why we set up our conversation cafe, to give people a space to come and to chat in a kind of safe environment. John, I'm looking at the chat line, and there's comments in there about the importance of communication, ensuring that people with sensory impairments are able to participate fully and engage. So I would ask you the same question as Jim. Do you feel it makes a difference when people start the conversation with what's important and what matters? Does that make a difference to you?
It is to me, is it? Yeah.
Yes.
Sorry, yeah. Sorry, I was on mute. Yes, absolutely. I'm deafblind myself, and I work for an organisation called Deafblind Scotland. And during the COVID, the lockdown, it became very apparent, and often people with sensory impairment, it was highlighted, it was magnified, the problems of people with sensory impairment communicating with carers, with staff, and also because of the lockdown, there were quite a number of organisations that were quite reluctant to go into the homes of people who are deaf-blind. And obviously communication with deaf-blind people has a wide range of in how you engage with those people, with people with dual sensory impairment. For example, we might have people who are blind first, relying on the hearing, have speech, and then maybe due to an accident, due to a virus, due to a aging process, they start to lose the hearing. How do we communicate with this group of people? We have people who are profoundly deaf using sign language as their first and only communication method. Their sight starts to deteriorate. How do we communicate with these groups of people? And obviously, the answer is around tactile communication, which is not well known about. It's actually imparting information onto the hand through letters of the alphabet, creating words and sentences, or it might be through sign language with tactile BSL, the person holding onto the hand. Obviously, this is tactile. So during the COVID, people weren't allowed to touch people. And if you wear the other option is to wear gloves. So we have guide communicators, that a specialist group of people who understand all different manners of communication. And it really brought home just how vulnerable, even more isolated, even more disengaged from society than even before lockdown. They were isolated and lonely, but they still have the option of getting out and about. But with the lockdown, it prevented them from getting out. The mental health issues increased fourfold. The only way to alleviate that was to bring in guide communicators who can actually communicate with them. So my mantra has always been about inclusive communication. Communication means involving everybody. However, where you have to change the way you approach somebody, the environment that you're in. I'm going to be awful here because during the lockdown, my work has been involving Zoom. And Zoom can be a nightmare for me. I have to engage somebody like electronic note taker to keep up with what's being said around here, because I've got about 4% of vision left. I've got hearing aids, and my main thing is lip reading. And my issue with Zoom is if people sit with their back to their window, their face is in a silhouette. So I can't see their lip pattern. So I'm constantly struggling to have to look at the font on the screen, but I'm behind because it's not on time. It's not live. It's probably 2 seconds behind. So until somebody asks me a question, I'm catching up what's there. So I have to be awful and say to Parveen, it's difficult to see Parveen's lips because she's in a silhouette. So it's just getting the environment right. So in order to get to listen in the first place, you have to engage with that person. If that person can't see you to engage, you have to think about the alternative methods. And it's just, it's a minefield. And I think in my clip, I was saying about sensory awareness training, sensory literate. Well, we talk about sensory literate now because it's about getting the understanding across the board of sensory deafness, blindness, deaf blindness. So communication is vitally important. But in order to get communication right, you have to get the situations, you've got to get the context, you've got to get the background, the environment. It's a whole gamut of information that you have to get right before you can even have that conversation. We have carers going into, who are just carers, going into some of our members' houses. They can't communicate with them because they don't know how to communicate with them, which means that person is even more isolated, knowing that somebody's in the house, but not able to engage with them. So it's just, everybody should have some more knowledge about how to engage with people. And that's my mantra, sorry.
Thanks very much. And I think it fits in very well, John, with our theme today, about hearing, listening, understanding, acting and responding. So thank you, Jim and John. And I'm going to open the conversation up now because we did say we'd have an opportunity to come back and to reflect on perhaps some of our comments in the chat and any questions that we have. And there were a couple mainly comments thanking for input, and similarly in the chat line, to things can be, and you know, true, what matters to you. I see a comment there, lies within our heart and our soul, and it's much deeper than that superficial level. So I don't know, I'm going to bring my other colleagues in, including my co-chair, Tommy, and I don't know, is there any points you'd like to reflect on from what you've heard?
Yeah, I think oh, sorry. Yeah, absolutely. Thank you to everybody for participating, and it'd be great to bring all the panel back in from Harvey and Sean, Jen, and open up to some conversations. But I think we have to reflect on how we listen to each other. I've tried to get better at reflecting. I often think I'm a better listener than I am, and I'm sure you'll tell me that I'm not a great listener sometimes. But I think it's really important we all reflect on on some of the clear messages we've heard today. I think, Sean, have you got any thoughts on what you've heard from some of our colleagues from the film?
Yeah, I think it's really I think it's very powerful as a this is a good example of an opportunity to stop. You know, like in basketball or whatever, you have a timeout. You know, this is a great opportunity for a timeout, both for people who are listening, hopefully and enjoying the conversation, but also for us as participating and listening to Jim and John and Janice and others in the film. For me, this is the message that keeps coming back, and I think I mentioned it in my little slot there was, well, we often say, for example, that you and your family are a vital member of the healthcare team, for example, in a healthcare setting, or if it's social workers in the community working with families, the family unit, that you're a team, you're part of our team, we're part of your team. Actually, that slip there is part of the problem. You're part of our team, we say, the healthcare professionals or the support workers. You're part of our team. Actually, no, it's the other way around. We have this privilege of having an opportunity to play some kind of supporting role in their team, and they're the team, not us. And I think that actually one of the things that's come out to me during COVID, thinking about healthcare, is we say that family members are part and carers are part of a vital part of the care team, and then actually we do a really good job of excluding them from the care team. So it's maybe some slightly controversial, but hospital visiting, for example, we should never drop below the bar of everybody having at least one person to support them. If we genuinely believe that carers and family are part of the team, or are the team, and we're part of their team, then we would do that. And I think that what COVID has shown us is we've still got a lot of work to do in that regard. And I'm not pretending that's simple. There's lots of challenges associated with that. But if we genuinely believed it was the right thing, we'd make it happen. Like other things that we genuinely, if you passionately and genuinely believe something's the right thing, you make it happen, kind of thing. So, and I include myself in that. I'm not saying this is someone else's problem. I was part of that process where families were separated from loved ones and things were really difficult. But in our day-to-day lives as public servants, we do that as well. We treat people as if they are, a manila envelope, using my old-fashioned experience of the healthcare system. All electronic records now, but this folder this individual exists, as a single entity, and that's just not, very, very few people exist as a single entity. You've got neighbours, friends, family, and using family in the sort of broadest possible sense of the word. And all of those individuals working together, you sometimes see this, and I'm sure you've seen it, that two people can get along and manage in life together, but individually they wouldn't be able to. So maybe an elderly mother and her son with autism, each individual couldn't actually exist without the other. So the son with autism supports the mum with her early onset dementia, early stages of dementia, and the mum's still able to support the son with his autism. But actually, if you separated the two individuals, they wouldn't be able to do it. So, people making sure that we're aware of those relationships. I'm thinking in the context of carers specifically here, and doing everything we can to strengthen them, rather than actually often we separate people and everything starts to crumble.
I guess for me, Sean, what it allows us to do, I think, sometimes as professionals, is take a step back and say, why are we doing it that way? You know, when we hear what a carer says to us, and I mean, I'm just thinking we did a huge communication exercise as part of remobilisation, and we involved over 1,000 people. We did online surveys, and we kind of said to them, we used the What Matters to You framework, and we kind of said, you know, thinking back on COVID, you know, how did it impact on you and your family, and moving forward, what matters to you in terms of, you know, priorities and how we remobilise. And again, you know, very different pictures. It's interesting that Jim spoke about, you know, his small community in Shetland and how people tend to know each other. And I chaired about 5 of the big sessions, like all the big public sessions, and I was struck there seemed to be that dichotomy between small rural communities where people seem to have the time a bit more to get to know the person, and how people felt those experiences were much more positive than in large communities, particularly in cities where they, you know, they were dealing with quite large primary care practices and so on, and you know, they didn't feel quite so listened to. So that was one of the messages that struck me. But another message, and I guess a couple of messages, but again, it's that standing back and saying, when you hear what people are telling you, what does that actually mean for us, and can we change the service? Is there something we can do? I mean, people pointed out, you know, the impact on inequalities. For example, it was okay if you could get access to dentistry in the private sector if you paid for it, but you couldn't get access in the public sector. Now, we were coaching this in terms of risk. I mean, what as a society, a culture, an NHS, we were assessing risk, and we were saying it's too risky to go to the dentist just now. And then people were saying to us, but, you know, this is really important to me because I'm in pain, and my next door neighbour can go because they can pay for it. So I suppose another thing, so what matters to me is I'm in pain and I want something done about it. I'm in a pandemic, so there's a risk around that, and I understand that. But why, you know, why is it in one situation, you know, this can be dealt with in another? And there was a very poignant case that was described, and it was a daughter who was a carer, but also a professional, actually, healthcare professional, who had been waiting for an outpatient appointment for her dad, and he was in his 80s and he had mild cognitive impairment. And of course, she took him up to the hospital but wasn't allowed in. So he went into this outpatient appointment by himself, not really able to describe what was different for him. And he came out to her, not really able to describe what the conversation was that he'd had. And she said, in the context of all of this, it just felt like a waste of everybody's time, a waste of the consultant's time at the outpatient clinic, a waste of her time. And, you know, why couldn't some provision have been made for her to wear PPE and to accompany her staff? And when we took a step back and looked at that, and I discussed it with Scottish Government colleagues, I mean, what they said was, in other areas, yes, she probably would have been able to go in. So sometimes we have unwarranted variation in things, and the what matters to you questions, I think, challenge us. And it's exactly what happened in hospital visiting, isn't it? You know, some people said, oh no, we can't do this because it's too disruptive with what happens in the ward. And yet other people said, no, we can embrace this because actually it's a really good thing. So I think one of the kind of spin-offs of what matters to you is it allows us to stand back and say, can we disrupt the system a little bit? And when we're listening to people and we're hearing things, can we actually make things better? Jennifer, I don't know if that was maybe your, you know, that was how it worked on your ward, because you had to you had the challenge of having to try to deal with some of these things. And I imagine not all staff view it in the same way. So, you know, there's a bit of like working together to show and to demonstrate that actually these things work. I don't know if Jennifer's still with us.
Yeah, you're absolutely right, Irene. People didn't originally, like, there wasn't this movement. People didn't say the words "what matters to you" and have all the meaning that it has just now, back 9 or so years ago. And it was kind of abstract to people. And there's a thing you said earlier about the political question and don't ask it. That is absolutely true. So see the vulnerability from when you're used to asking people, like a decade ago, questions like, do you do a bowel movement every day? You know, sorry to, but this is like, do these kind of questions to what matters to you, right? Forget all that. What matters? People were like, it put you in a position of vulnerability, and not everybody was in a headspace to be able to say, yeah, we'll just do that straight away. You know, this is a journey. And that vulnerability, when people get used to that and they realize how important it is to have that meaningful conversation, it's so empowering. It's empowering to have a feeling of vulnerability. And in fact, it translates into every other part of your life and your work. So even this week, I was chairing a meeting and it wasn't very good, right? The meeting wasn't going very well. And it didn't know what it was trying to do. And I thought, okay, I'm okay with saying, guys, this meeting, I don't think knows what it wants to be. Let's do a wee bit of live learning and action and reflection. What's important to us? Like, what do we want this meeting to do? What matters to us in this meeting? And you can, plenty of other difficult conversations I've had with staff and families and complaints and difficult circumstances where you feel that something isn't going that well. You can do that pause, a bit like what Sean was saying. You just take a pause and recalibrate with the what matters question, and it changes everything. It changes everything. It changes the direction of the conversation. And I think vulnerability is a good thing. And it's one of the things that we're trying to spread in this movement. I think that making it an equal conversation, it's just so important. So yes, I'm glad you said that, because it really pinned it down, I think.
Thanks, Jennifer. And I understand we've now got our slide presentation available that we can show that we just asked our staff. So I'm thinking that what we'll do is we might play that now, and then I'm keeping an eye on the question and answers and the chat line. You know, I think we'll pick up any final points from the chat and the question and answers after the film, and then we'll close the conversation. So okay, well, Jennifer's going to play that for us, and I'll just ask if, you know, could you keep the questions a bit short in the chat? That would help. But in the meantime, if our panelists are able to just have a wee look at them as well, and maybe give us some reflections, that would be helpful. Thank you.
just come in really quickly, just for a wee second, if you don't mind. It's been really interesting because actually Jen, one of our colleagues at Carer Voices, I've never met Jen in person. We started working together as COVID came into place, and we've never met in person, as with some of the people on that little slideshow. And actually, I found it, as colleagues were sharing with them, I got to know a wee bit about them. I got to know what makes them smile or feel safe. And I thought it was lovely. I thought it was lovely for our teammates to share the things that matter to them. I've yet to meet some of the people who sent the slides in. I speak to them a lot on Zoom, and we engage and work together. So it was quite heartwarming for me to find out a little bit more than a typical Teams or Zoom conversation that takes place. But I'll hand you back to Irene.
Thanks, Tommy. I didn't recognise some people. They were pretty up looking, I've got to say. But I absolutely agree with you. You know, it tells that story that goes beyond just the business. Now, I know Sean wanted to come back in on something, so I'm going to invite Sean, Parveen, and Jennifer if they have any final remarks, and John and Jim as well, just in closing.
Just a very quick one. There was a comment from Lorna in the chat about, you know, everyone's tired after COVID, and that includes people who are at home who've been caring, staff working in hospitals, carers in the community, you know, home care support workers and so on. And I wanted to just sort of draw, there's a really good evidence base around. So sometimes what you hear is well, we're out of compassion. We're just tired, you know, we need a break kind of thing. And emotional burnout is a big deal. And it's a very real problem at the moment for a lot of people in all sorts of different circumstances. But can I just say that we talk a lot about vaccinations and immunizations at the minute for COVID. If you want to immunize yourself against emotional fatigue and burnout, the best possible way you can do that is to have a what matters to you conversation, is to connect compassionately and listen to someone else, and then if you can, to do something with them to help them. That is the most powerful way to rebuild your emotional resilience and compassion personally. So, you know, there's a little bit of selfishness in there as well. You know, if you want to actually get something that's good for you, go and listen to someone and have a what matters to you conversation with them. So enough from me. Let's hear from John and Jim and Parveen as well.
One of the things I just wanted to pick up from the Q&A, and maybe panelists would like to reflect on it, but, you know, how can we get this? In fact, we talked about this yesterday with Maureen as well, Maureen Bizignano. How can we get this? It feels like some of the softer skills. So, you know, in universities and training and SQAs, you get taught things to do, and in the chat line you'll see in the Q&A, you know, people asking, how can we actually get this into the universities? How can we get new student nurses? How can we get social workers? How can we get people recognizing this as part of the job rather than just a kind of soft add-on if you feel like it? So I don't know if any panelists want to reflect on that. Jennifer, have you got any thoughts on that?
Yeah, so I know Tommy, I was wondering if Tommy was going to say anything there, because I know he does speak to, he's got connections with a lot of the HEIs and speaks to thousands, I think, of student nurses. I also do that. We do link with them, and a lot of nursing students will get something about the What Matters to You as part of their curriculum. And induction here in GGC, we certainly, it's in the induction as well. But you're right, Irene, we need it mainstream. We need it as a fundamental principle of health and social care, really, and beyond that. So it's, yeah, more work to be done there. But I think we've started linking with HEIs, higher education institutions, and also through induction processes. And building days like this to raise the profile and involving them within it. But yes, more work to be done.
And it is I was going to say it's a societal and political thing as well. It's a societal and a political thing as well. You know, how the whole system is designed pushes people in a particular direction. So, you know, if you, and I'm not political in a party political sense, but, you know, we need to, our politics and our society needs to decide what type of health and social care system do we want? Do we want one that's driven by performance management and targets? And it's not that those things are bad of themselves, but those are the primary drivers at the moment in our healthcare system and our social care system. Or do you want a health and social care system that's driven by what really matters, listening, understanding, and building up from there? And those are the things that inform our targets and our performance management objectives.
Can I just come in very quickly?
Irene,
Yeah, thank you. Just to say that if we're talking about an inclusive culture, then the culture, you're absolutely right, needs to change. And that culture needs, in order to be inclusive, needs to understand that, you know, some of those skills are like softer skills. So how would you measure? How would you be able to tell whether or not your culture is changing? And again, you've got the usual sort of customer satisfaction and your patient care and your lived experiences and things, but it's not something that, you know, you couldn't put it in a job description or a person's spec as we need to have these qualities, but it is within the values. And if the culture and the value, and it's value driven, then again, these are the qualities that will come out. So what matters to you is really important, because it's shifting the power. And in order to shift the power, you need to change the culture. In order to do that, you need to have certain skills that you've got to demonstrate, which is with the active listening skills, the confidence, the courage to ask those questions, because what you might get back is something that you might be totally unprepared for. You can't make assumptions around. Again, how do you deal with that? So Jennifer was right earlier, I put up in the chat that adding to the vulnerability, there has to be some empathy as well within that, because you're inviting people to share with you their lived experience of what matters to them. But you have to be prepared that it's not always something that you might be able to, respond to in the right way. And those aren't skills that you can teach, but they are very much, in my opinion, it very much lead towards the culture of an organization. And if it's about inclusivity and the values of the organization to be inclusive and to be diverse, then I think eventually you would get there. But it is much harder to measure. I would say that, yeah, absolutely.
I mean, I noticed in the question and answer, staff, how do you approach a manager if you're a member of staff that's interested in this and you want to do it? Sometimes it can be very difficult to have conversations with managers about this. And then I also noticed in the Q&A someone filling in the getting to know me form for her mum, and the one person who read it was the anaesthetist. So as you said, Jennifer, there's a way to go. But I think the important thing is that, through days like this, we are continuing to raise awareness. I wanted to give the last few words to John and Jim, if there were any comments. We've had some great questions in the chat. I've tried to kind of sum them up because some of them are quite long, but in the main, I think it's people feeling sometimes they want to have these conversations, but they're finding it quite difficult to have them. And then in the case of the lady who filled in the getting to know you form, and I know those forums, that really it wasn't shared enough with the staff. And I guess it's coming back to what our panelists have been saying, that it's a work in progress and we're maybe not there yet, but let's keep plugging away at it. And somebody that plugs away at it every day is Tommy, because he's out there talking to staff, talking to students about the whole thing about intelligent kindness and what matters to you. And I think it's about 250,000 people he's spoken to by now. So hopefully we are slowly beginning to bring about that culture change, and sessions like today start those conversations. I don't know, Jim or John, are there any last points you would like to come in to make?
I think, empowering staff is one of the ways forward. Right? The biggest problem we seem to have is that managers dictate to staff, I want you to do this, I want you to do that. Right? When people have been trained and have the skills to do a job, right? Let them get on with the job and empower them to do that. Right? Have flexibility, allow people to bring their own personalities into their work so that they could sit, right? This is what we try to do in Shetland with our social care staff. Right? You know, when we came about doing carer support plans, we involved them in the production of this, right? You know, so that the staff can go out there, right, and sit and have a discussion with a client. Right? And unfortunately, you know, we're in a system somewhere that, you know, managers are frightened to give up that little bit of power. You know, so let the staff go out there and give them the freedom to do their job properly, I think would make a big difference.
Thanks, Jim. And Jennifer's agreeing with you in the chat line there. She's saying just go for it. You don't need permission, just do it. So that's a great message. John, any last comments from yourself?
Yeah, come in there. Again, it's all coming down to being listened to and having an understanding, having shared thoughts, I mean, everybody has a story, you know, and it doesn't matter if they have a disability, they've had a life, they've got families. But quite often people will just see a disability and think, oh, I can't cope with this. But it's actually breaking down barriers, and how we break down those barriers. And over my lifetime, I've always felt that meaningful communication involves two people having that shared method of communication. So if it may be for somebody BSL user, somebody has to have the BSL skill or use an interpreter to interact. But sometimes having an interpreter might not allow that person to break down their, you know, give their true feeling because there's a third person involved. So if both people can do BSL, then that can actually open many doors. It's like working with deafblind people. You know, if you're working one-to-one and you have transferable skills and you can communicate back and forth, you get an awful lot of information out of people, you know, by having a shared communication method. And just one of the things when we're talking about the training, I've been working alongside the Alliance and looking at the new national care services. And we've actually developed this training, which is free within Glasgow, because we've been working with the NHS Greater Glasgow, and we developed a training program which we can share with you guys if you want to come in and be involved. Just having that different ways of communicating, different ways of approaching, and breaking down communication barriers and repairing them where they do fail is just so vitally important.
Thanks so much, John. Colleagues, we're just out of time now. Can I extend a thanks on behalf of the Alliance to everyone on the call today for joining us, for the chat and for the questions, and particularly to our panelists and our film participants, to John and Jim, to Parveen, Jennifer and to Sean, and to Tommy. He's gone off my screen. I hope he's still there. But just in closing, just want to say that this is day 3 of our conference. We still have 2 days to go, and we've got some excellent sessions just still to come. If you're on Twitter, we'd love you to be tweeting, and we'd also really like it if you would complete our evaluation form so that we can get feedback that we can use to improve and to develop further sessions. So thank you all. We've got a great session, by the way, on Friday afternoon with global expert Professor Linda Bald from Edinburgh University on COVID and what next. So that'd be a really good one to join as well. But can I thank all of you very much, and especially Tommy for arranging the session and for putting everything together and working so hard on the film, and look forward to seeing you later in the week if you can join us. Thank you very much.